Another very common question that we get asked is pain. In other words, 90% or most of the majority of the emergency room visits that I encounter, but also not just emergency room, otherwise, is pain. And sometimes people are not even as concerned about what is happening as they're concerned about managing pain. Now, pain can be classified easily into, is it acute, adaptive, or helpful pain? In other words, if I put my hand on a hot stove and it burns, it tells me to take my hand off. Now, there's also the chronic pain, such as pain of diabetic neuropathy, that if you feel like you're in a hot stove and you just can't get off of that. Pain can be a maladaptive experience. So in that respect, we're working with the pain. Now, the sound technology does not take away the hot stove. What we do work with is the modulation and perception. For instance, modulation. Pain can be either down-regulated or up-regulated. Certain states, such as anxiety, such as depression, and others, or fear, will actually make the pain worse. I've had a young man, for instance, who had a very minor first-degree burn, like a sunburn, basically, for instance, and he was beside himself, severe 10 out of 10 pain, or as he said, 20 out of 10, and nothing would help, not even heavy-duty medications in the emergency room, until he fell asleep, and then he forgot why he was there. Then there's other examples where the adrenaline kicks in, and even what should be severe pain is perceived as minor. This is one of the aspects we work with, modulation. And that's all an aspect of working with the brain and brainwave states. Another aspect is perception. Some pain is perceived as, well, it's good pain. For example, in exercise, when I work out, no pain, no gain. My muscles hurt, but I know that it's for a good purpose. Now, I have also had some broken bones, and that just didn't feel so good. So, but again, working with perception and working with the interpretation and what it means to us and how to control it plays a big difference. So again, in summary, when we use sound technology, we work with the two factors. We work with modulation, we work with perception. And of course, working with the underlying brainwave states makes a big difference.